Hi, I'm Dr. DC Fidler, and I'm here with my friend and colleague colleague in writing and psychiatry, Dr. Paul Rashid.
Hi.
And Paul, you're a writer.
I am now.
You are now. How did you come about being a writer?
Right. It was not an easy journey.
Okay.
I never considered myself a writer. I always considered myself a biologist, a scientist, of course studying medicine. And then working as a psychiatrist and then doing an additional specialty fellowship in social recovery, I discovered a very effective and powerful treatment that empowers my clients that wasn't out there for people to utilize very easily.
Now you're talking about something that's beyond medications and usual things we think of with psychiatrists.
I am. So I completed my entire psychiatric training and I was in this fellowship program through the VA system, and I learned about recovery. And it was great because I'm learning this new aspect, this additional layer we can add to treatments for medical and psychiatric conditions. And I'm able to use this with my clients, and I'm reading the research and seeing how powerful this is, and I'm able to help my clients one-on-one. But when I think back to our mission to help people, and we know that 1 in 3 individuals are going to experience some form of psychiatric condition or a severe medical condition in their lifetimes,
Okay.
that there's just a lack of treatments available. There's a lack of medical doctors and psychiatrists, and I just thought there's such a need for this, that people can incorporate it into life. Yet when I researched what books or topics there are for people to learn about this, I didn't find any.
So not medications, not psychotherapy, but the addition of
social therapy.
social therapy.
And I think it's a simple concept, but it's a new concept. The way I've articulated it is, well, in medicine we use a biopsychosocial formulation.
Correct.
So we look at the biological aspects of the individual, their genes, their medications, the side effects of medications. We look at the psychological makeup of individuals, their individual experiences, their environments, traumas, the way they cope, their personality.
Right.
And then the social domain, which is education, socioeconomic status, work, community, spirituality, hope, all these elements. And I discovered there's all this research showing the power of this. Another way I explain it is a metaphor compared to physical injuries. So if someone has a musculoskeletal injury such as a broken bone or fracture, they would go to physical therapy for a physical rehab. So social recovery or social therapy is a social therapy for psychological, emotional, and even medical conditions. It is so powerful because it is 100% up to the individual's control. It is drug-free. People can use psychiatric medications and medical medications with this therapy, but it's not necessary. It is very empowering, and it takes the individual from a hopeless and despair to an empowered perspective, because there are things they can do and implement in their own life and take back their health and wellness.
So is it fair to say that in so many of our programs and treatments across the United States, we were not helping people with the social aspects?
I would say the majority of providers and psychiatrists don't prescribe treatments for the social domain.
Okay.
And we know that medications are effective. We know that psychological therapy is effective. And now we know that there are social elements that are very effective. What if we then stacked each therapy on each other? Think how much more synergistic, how much more of a robust treatment effect there could be.
Now, how is this connected to your becoming a writer?
Well, when I had this, I'm learning about this therapy, knowing that most interventions are not geared in the social recovery element. I said there needs to be a book that anyone can read to learn about this. So I wrote the book Recovery Revolution, a social recovery blueprint for optimal mental health. And in it, I discuss my approach to social recovery using 10 different elements of recovery. And the way I explain it is my wheel of recovery. To make the simple analogy that, we have the 10 different elements in a circle with the individual in the center, and I think of it like a wheel of a bicycle, and each element is a spoke. And we know that, you may not have every element. Each element of recovery may not resonate for you, but if you have enough spokes in a wheel, that bicycle wheel is going to move, and your life's going to move forward, and your health and wellness is going to be moving forward. If you don't have enough of those spokes, that tire is going to be flat, and you're not going to be moving in a growing.
What's an example of one of the spokes?
Okay. So one of the spokes, we talk about. I'll mention spirituality. Okay. So someone may have a religious background that we can leverage and use and make sure people are incorporating. Sometimes, for example, in depression, many times people may stop going to their religious practice or stop praying. And part of that is just leveraging that and making sure to incorporate that back into their routine. Another example under that domain would be just general spirituality. Maybe it's just connecting with that higher power, that source. For some people, that might be connecting with nature. And we know that getting outside, I know that studies show that by getting outside into a park or green space actually calms down our nervous system and decreases the amount of stress hormones that are floating through our bodies. And if you're able to incorporate ideally an hour a day, but even a minute a day can have a profound change within our brain and stress levels.
So would that include something like also being around people and socializing?
Absolutely. So the one study that really opened my eyes to social recovery was social isolation. There was a study of comparing socially active people to socially isolated individuals. Those that were socially inactive were 50% more likely to die.
Wow.
So it really just shows the connection of the brain-body connection, and how when we're not engaging socially, there's a real direct effect on our bodies.
So people may have had hallucinations treated with medications, but because of the hallucinations, they've quit socializing.
Yes.
And no one's prescribing socializing.
Right, and it could be life-saving. And the one other thing, just to mention that is, people might say, okay, socializing good, but again, it's not just fluff. And actually, just to put a number to it, it was the number of social contacts, not the length of it. So if I would just say they were looking at specifically an intervention per week. So if you can have one social activity a week, whether that's with a friend, with a family member, going to a sports game, or joining a sports league, do one thing a week socially engaging, and that's enough to make a difference in your life.
Now I remember we used to have a nurse on our unit who would prescribe to patients informally to go to a large hardware store where they had classes on just learning, putting down tile or painting or the woodwork or something. Would just prescribe to go take 1 or 2 classes a week. Would that be an example?
Absolutely. I love that example, because what's going on with that simple prescription?
Right.
You have someone getting out in the community, learning something new. So that is one of the elements, is education and work. So learning a new trade,
And there were other people in the class.
And you're socializing and learning from not only the teacher, but the other people,
Okay.
your other peers. And I just love another element of recovery is purpose. And in this regard, it may not be the individuals, they're not going to go out and become a carpenter, but it adds a dimension to the life and meaning in the world around them, and what this could add and maybe enrich their life.
So this is what your book is about.
Yes.
Fantastic. And this is available.
It's available on Amazon
Okay.
directly. People can find it and start taking control of their own physical and mental well-being.
So there's a self-help. So it's not just for people who are treating other people. It's a self-help book.
It's a self-help book for individuals, and it teaches them the 10 elements to help them empower their recovery, both physically and
Now, would this help all of us, whether or not we're recovering from a psychiatric diagnosis?
I've had people tell me that when I was getting feedback from editors saying that they were just benefiting with different pearls in the book. So I
Okay.
believe that there are some elements, even if someone doesn't have a clinically diagnosed psychological condition, there are some benefits. People can pick up things from the book and add them to their life. And again, just finding one or two little things in there could really make a difference. Into a more rich life, I think.
Well, fantastic. Thank you, Dr. Rashid.
Thank you, Don.